Mental Health Monday on Radio City Talk with Mick Coyle.
Radio City Talk.
My name's Mick Coyle, a Mental Health Extra from the team that bring you Mental Health Monday. It is a Tuesday, and if you subscribe to this, you'll get it automatically free into your podcast provider, wherever you find that, on your tablet or on your iPhone. We got Jake Mills from Chasing the Stigma in the studio. Hello, Jake.
Hello.
Your ears were burning yesterday because we were talking about you. I always say if you want to email the show, you can do mick@radiocity.co.uk. Can I start with an email, Jake?
Start with an email.
Dear Mick, many congratulations. You have been shortlisted for the 2018 Mind Media Awards in the radio category. Ta-da!
Yay.
Good news there. It says that we had an incredibly high level and standard of entries this year, and it was a very tough job for our shortlisters, but it was felt that your entry fully deserves to go to our judging panel. So basically, we put together a 15-minute tape, I think it was, of the 24-hour show that me and you did on the 15th of January of this year to kind of go, look, we're talking about mental health on the radio. Mind Media Awards are these sort of very swanky London occasion, and you get people from all kinds of walks of life involved in there. So we're up and about now. Please keep this news confidential for now. No. The embargo's gone. We're okay. Hashtag Mind Awards. Thank you to everybody on that. There's going to be a do. It's going to be at the South Bank Centre in London on the 29th of November.
South Bank Centre?
Yeah.
Oh, okay, it's changed.
Yeah. Congratulations again, and thank you for entering. Best wishes, the Mind Media team. There you go. Congratulations, I've been shortlisted for the Mind Media Awards. And I thought, oh, cool, blimey, that's a really good one. That's some really good news. Because, of course, the 24-hour show tried to sort of take mental health to a different level. We're up against BBC Radio 5 Live, LBC, Newsbeat, and BBC Radio Wales. I've looked down the list as well. We're the only local media organisation that get a nomination.
That's amazing.
So we've done all right, but in that regard, I think everyone else who works in the local media should be doing a little bit more. The Guardian have been nominated for various things as well. I'm very pleased to say that from a local point of view, Hollyoaks has once again been nominated for soap or continual series for the work they do.
They win last time?
I think they did, yeah. I've got a feeling Coronation Street might have a good shout this year as well. Just to give you a sense of who else is nominated, in the News and Current Affair category, which we could enter as part of Mental Health Monday, the BBC News at 10, Victoria Derbyshire on the BBC, and the On Your Mind series from Channel 4. So these are really, really sort of big awards, dramas. Flowers, Killed by My Debt, if people saw that on the BBC, BBC Radio. There's a lot of people from the BBC who've been nominated, and we're going to be showing up there a little bit later on this year, Jake. Although I'm just looking down the TV section, and I think there's a Davina McCall show which has been nominated. Now, I think I'm right in saying the Davina Hour by 2020 Productions, which appeared on the W channel, is the TV show that you were actually on.
Yeah, I'm basically.
So have you been twice nominated?
I'm just clinging on to other people's nominations, which I'll take really. But yeah, no, I think. Well, first of all, I think congratulations, big congratulations to you for kind of you've been doing Mental Health Monday, and you've been doing it so well for so long, and you wanted to do something more and something bigger. Also to Lizzie and Layla and Dave as well, who were the producers on the day, over the 24 hours and beyond. I think it's testament. I really do think it's the least that you deserve to get that nomination.
Thank you.
And just on the Davina show as well. That I've done a lot of kind of different interviews and been on different things. The Davina one, as well as yourself, I think was different to any other one because they done it genuinely, and they done it like, kind of, they wanted just to listen and talk about it in a kind of responsible manner, and made it about the people, and it was really professional and really well done. So again, well done to all the team who were on that. And yeah, just kind of thinking back over what we did achieve in those 24 hours. You posted a picture on Twitter, and it's at the end of that, and I've got a coffee in front of me, which I think is just the most ridiculous thing. Why did I have a coffee in front of me on the last bit of it? But I said, and I stand by that 24-hour show is the best thing I've ever been part of. It was an absolute emotional roller coaster, wasn't it? Particularly that last bit.
Oh yeah. Kenny says, so happy for you and all the team. Touched so many raw emotions, that amazing journey you all went on. I know you all didn't do it for the accolades, but it's much, much deserved. Big hugs. Thank you to everybody who's saying nice things. Brett said, brilliant news. Well done all. Yeah. Somebody else has gone, this is the show I was telling you about, tagging in their mates. Yeah. So pleased for the team. They worked so hard in making this truly exceptional, memorable broadcast. The nomination is well deserved as well. I'm just going to mention, thanks to Angie as well. Well done, guys. The 24-hour show was epic. What's that? OK finger type thing. Fab as well. Special mention to Pete Price. I remember it getting to like 10 o'clock and then thinking, what on earth are we going to do now? Because at 10 o'clock at night, we've been on since 9 o'clock in the morning. I kind of thought, right, we've kind of made our point here now. I think people are going to have got it by now. Yeah. But then it was like, oh, but now we're only just halfway, just over halfway there. And then Pete Price, if I remember it correctly, maybe I'm misremembering, the door flung open, this bright light appeared, and Pete Price shone on through and then just talked for 4 hours. And it just got us through that sort of like 10 a.m. to the middle of the night, 10 p.m. to the middle of the night section.
Yeah, it's like he dragged us through that with sheer force. He didn't like come in and be like, you know, how you doing? How you doing, lads? You okay? He just came, okay, here we go. And he just properly went forward in. And do you know what? It was exactly what we needed. I think looking back on, if I was to analyse anything that I wouldn't do, I'd have not left the room at any point for any break whatsoever, because that was the worst thing that you could do, because you had nowhere to go. That was the weirdest thing about it. So if you had a little toilet break or anything else, or a little wander, you couldn't go outside or anything.
The best thing I did was I changed my shoes. Now this was based on some advice that I think it was Ron Howard, the director. Someone had said, when you're doing like a day-night film...
Ron Howard gave you some advice?
Yeah, Ron said, Mick, I know you've got this thing. He said, I'm just filming the new Dan Brown movie. He said, Mick, whenever I'm doing a day-night shift, I always take a pair of shoes to change into. So you can change your clothes and you just feel like you're changing your clothes. But actually, if you change your shoes and socks, it actually feels like you're doing something, because if you are going to go out, the last thing you do is put on your pair of shoes. It's almost like here's the start of the next thing I'm going to do. So to change your shoes is a psychological benefit you give yourself by saying, right, now I'm going to do something else. So halfway through, I changed my shoes to a slightly more comfortable pair, I'll admit. But this idea that psychologically it'd go, right, you're just leaving the house now.
Yeah. I mean, that's great advice, and I appreciate you giving me that 9 months later. Thanks for the heads up.
I also, every credit, by the way, to everybody involved. So Pete Price, producer Lizzie as well, who booked in 73 different guests, some of whom I don't think we even found out some of their names. They just came and sat down, we talked for a bit and they left. 73 guests. Layla, who was all over the social media on the day, Dave Downing, who was turning around the audio, doing social media across that as well on Radio City Talk, editing videos and all sorts. So it really was a team effort. Obviously, Pete Price coming on board and doing that in the way that he did, in only the way that Pete Price could as well. It was a very special day. I don't mind saying now that the marathon had a severely detrimental impact, I think, on my own mental health. Yeah. The Christmas before... I was having sleepless nights. I was having panics about the idea that we were going to do this show, and it was going to be awful, but I kind of have my faith in myself to be able to talk. But I was just thinking, what if I can't carry on talking? What if I run out of things to say? What if there's nothing left to say? What if people sort of clam up, or people don't want to be open? And I had this thing where I knew you were always going to be there, but I was thinking, well, I like Jake now, but where am I going to be? And like, there was like night, and it was all the way through that Christmas period where I couldn't relax, and I had a little bit of a cold at the start of January, and I was going to think, right, this is the flu, and it's going to be hitting me on the 15th, and I'm going to have to cancel it, and I'm going to let everybody down because I'm going to be too ill to do it, or I'm going to start it and we're going to have to call it off, and the whole thing will be a disaster. These are the sort of fears you have about these sort of things.
No, I definitely shared them, and it just, I think I said it on the day, but when we first came up with the idea and we said, yeah, let's do it, 24 hours, just like, it was just an idea. It was just a thing that, it was just a number. And as you got closer to it, you realised just how long it is, especially around Christmas, when like Christmas is the longest day ever and it's only like 8 hours in and you're like, oh, I'm ready for a little afternoon nap here. And the idea of being able to go through all night just seemed impossible. Even on the day, even at points in the night. But actually I say that, and I have to be honest, I think it went a lot quicker than I thought it was going to go.
I think you're remembering it differently.
Yeah, probably. I think what helped was that it was non-stop, and it was just guest after guest, and everybody who came on spoke so well. Everybody spoke confidently, and you know, they were all enthusiastic, and that really helped. I think probably the thing that helped me more so than, well, as well as the Pete Price stuff, was that little section that we had at like between like 3 and 4, or when we had the panel about, was it between 2 and 4 or something?
Yeah.
That was good, because it got a bit silly in that, but that helped me, that I think.
The other thing as well, and this, I'm not going to get soppy about it in any way, shape or form, but, you know, when we talk, the whole point about doing Mental Health Monday and talking about mental health is that you're allowed to say, and you're allowed to talk about mental health. You know, when I was doing my journalism training, I was told, this was what I was taught, that asking a question, how do you feel, was like the stupidest question you can ask because it's lazy. But actually, I realised in that 24 hours, that's the best question you can ever ask anybody, not just when you're a journalist, anyone. How do you feel? Yeah. Like, that is, in many ways, the most important question you can ask. And actually, for me and you, going through that, and for people who were with us for hours at a time or listened for the entirety of the whole thing, we were through the mirror, if you like. If society has got a stigma around mental health, it didn't exist in this little bubble that we created. Yeah. So actually, for us, we've seen sort of the future. We've seen what it's like when you can sit down and talk about how you felt about something, how you feel about something, how something makes you feel, without thinking, oh, everyone's going to have a go at me for this, or people are going to think worse of me. Actually, we had those conversations. We had those conversations for 24 hours with none of that stigma and with none of those moments, and our listeners heard that at the same time. Yeah,
and I think that came across in every guest that we had as well, because I think every guest who came into the studio or on the phone knew that it was that safe place, and despite the fact that we were broadcasting live, still were like so kind of willing to open up and talk about it, but as I say, with confidence, and I think that was because of that kind of environment, that not just what we'd created but what the show had created. And I remember afterwards, and I was walking through Lime Street, I was just crying, and I didn't even, I wasn't sad. I think it was just sheer exhaustion and pride and relief. And I don't even know if I was crying, but there was just tears coming out of my eyes. And I seen someone I knew, and she was like, "You all right?" And I was like, I don't know.
The question is, I get asked again, are you doing it again? No. We're going to do something else, hopefully, on the 15th of January coming up, or certainly close to that time as well, to mark that. We have got ongoing plans as well for sort of a wider plans in regard to mental health. And the other question is, people go, did you have like a couple of weeks off after that? I was like, no. We went home on the Tuesday. We were back in doing the show on the Wednesday.
Yeah.
We did like a week and a half's worth of broadcasting in one day and then carried on.
I actually think that was the hardest bit, was when you went home and trying to get sleep in the day and trying to get back into it and going to work the next day. I think that was actually the hardest part of it all.
Thank you to everybody saying nice things across social media. Really appreciate your warm words, and thank you to everybody who helped us out on the day itself. Hopefully we'll have a bit of information about what we're planning to do in the next year, and we'll see how we get on at the Mind Media Awards end of November. South Bank Centre. Very nice. Jake, you got a lot of mentions on Mental Health Monday this week, by the way, because your Hub of Hope team were in. I just wanted to mention this through the University of Chester. Their Warrington campus have got this course which Dean McShane runs. He's works in mental health, but they look at an entire spectrum of things from dementia and all sorts to get people into nursing as well. I was quite heartened by the idea that there is a generation of nurses who are coming through who are ready to work, who are enthused, who like the idea of working in mental health as well, who are looking for opportunities as well, that if we do create those opportunities, that there will be people coming through ready to take those opportunities in counselling or therapies or whatever it might be.
Yeah, I was really proud listening to it yesterday, to hear them talk about what they, as kind of mental health nurse students, what they would get from it. That made me proud, because obviously I came up with the idea based on the people who are looking for help for themselves. You know, that was kind of where it came from, or loved ones, and to be able to allow that to grow and to be that kind of tool for practitioners and stuff was really kind of heartening for me. As you said, the team themselves are absolutely brilliant. The team of staff and students who've come together, they're really passionate about it. They're doing this again. They've already done it, and they're doing it again purely because they got something from it. They want to give something back. At no point have I gone to them and said, will you do this for us? It's all been them. They've drove that forward from a conversation in a car park at the end of a conference where they just said, we'll do this for you. And the team of staff and students came together. They gave a whole day, almost 250 services added, and then straight away afterwards they were like, well, can we do it again? And it just shows you just how kind of many good people there are out there who want to make a difference and are so willing just to give their own time to be able to do that. Absolutely. I mean,
cynically, I would look at it and I go, isn't it a shame that actually it requires goodwill to make something like this happen as well? But actually, data, people say now that data is one of the most important things that, that you can have about things. And you obviously have got a lot of data now based on the different organisations. Presumably there's a great value to that, but it comes with no fee. You're not charging people to access it as well. And I guess it would cost you an absolute fortune if you had to then just go out and find that information or pay somebody to go and find that information as well.
Yeah, don't get me wrong. I'm not coming into this kind of with when we're looking at future proofing this, we're not dependent or relying on people to volunteer and to do that, particularly coming from a background of doing comedy and doing writing. Where you're asked to do a lot for free. So I know kind of how that works, but it just shows that people are willing to do and willing to give back. What we've done as a charity is we've spent the last year proving that this can work, that it's needed, that it's achievable. And now it's down to me and the trustees of the charity to move that forward to say, now we need investment. Now we need to build this. We need to build a team around it. And that's what we're going to be doing over the next couple of months now, is to take that evidence forward to say, look at the importance of this. But quite frankly, without the volunteers, which you heard Dean say yesterday that they want to get at least another 250. That's 500 organisations that wouldn't be on there if it weren't for them.
Hubofhope.co.uk, we always mention it as part of the programme. Hubofhope.co.uk if you want to find mental health services close to where you are. What else is on the agenda this week, Jake?
So tomorrow, Chasing the Stigma is actually up for a Charity Times Award. So hopefully, if we were to win that, it would be an incredible achievement for a charity that is basically running from my kitchen. Just to be nominated is a huge achievement for us. So hopefully with that. Also with the Giants in Liverpool, we will be doing bucket collections. So anybody who sees us, we're not just we've been granted permission by the Liverpool City Council. But any money that we can collect, we depend almost entirely on public donations. So any money that we can collect will go a long way in helping us help other people.
And will people see you branded?
We'll be branded. We'll have big orange buckets. So, yeah, look out for the T-shirts.
Jake Mills, thank you for your time. A man who operates Chasing the Stigma from his kitchen, his living room, or the toilet, wherever he's basically got a laptop, he will operate his charity from there. Jake, thank you again for being part of the 24-hour show. And are you coming with us to London? You're twice nominated. In fact, if we can get the other production company to pay your travel costs.
As long as someone pays for it, I'm not bothered.
Thank you for your time.
Mental Health Monday with Mick Coyle.
Radio City Talk.